Hello, 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 Facebook. I am Dr. Myla Bennett of Adair Plastic Surgery and Medical Spa in Johns Creek, Georgia. And tonight I want to talk about who is a good candidate for liposuction. So I see a couple people have jumped on with me. It's not showing me people's names though. There we go. Hey, Tommy. There we go. I was like, where's the names? Hello, Stephanie. I'm going to give people just a minute to get on with me before I start talking. Hi, she Jag, is that it? Hello, hello, hello. Did you guys all have a good Memorial Day weekend? Keisha on Fleet Carson, yes, I do charge for a consultation. My consultation fee is $150. Good evening, Liliana. Hi, Tab to Shield. Hi, Tiana. Hi, Angela from Arkansas. Welcome, welcome. If you guys don't mind, go ahead and share the video and let other people know that I am on. If they got questions they want answered about lipo, I can answer their questions too. Or anything plastic surgery. Hi, Maria. Hi, Janet. Yes, so I do charge a consultation fee. People who've been following me for a while know that I don't work for free. I just feel like I don't want to waste my time with people who aren't serious because, I have a business to run and I paid a lot of money for my expertise and I'm a surgeon and I should be paid for my time. So can I pay when I come or not? No, in order to make an appointment on my schedule, you have to pay the consult fee to hold the spot. So you can't just you can't just walk in for an appointment. I don't take walk-ins. So you said you're going to be here on the 6th. Go ahead and you can reach out to my website or if you DM me your contact information, I'll have my staff reach out to you. And I would love to meet you in person and see if I can help you. I'm pretty sure I can. So, all right, I'm going to go ahead and get started because it's late. So I just had a road trip. I was in Ohio all weekend and I just walked in the house. And I wanted to go ahead and I posted earlier about my liposuction special and I wanted to talk a little bit about lipo. It's kind of to go along with that. And then I'll talk about how you can find out about my special that I never have. I have one once a year and this is the time. And it's only this week. And, to find out the rest, you got to reach out to my website and put your email address in, and my staff will contact you with the details. Thank you, Shanika. I'm going to post some pictures of, I was at my mom got married this weekend. And so I was at her wedding. It was her wedding weekend. So it was a lot going on. And I have a bunch of pictures in my phone that I need to put on Facebook to share, but I've already put some stuff on Instagram. And Myla Rose was a flower girl for the first time and she was a professional. It was hilarious. She was so cute and she did a good job. She dropped her basket at the top of the aisle. She dropped it again at the bottom of the aisle. She went up the aisle, walked down the aisle, walked back up it and went back down. It was hilarious. It was so cute. But anyway, I'll post that. If not tonight, I'll post it tomorrow and share some of the pictures from the wedding weekend. It was a lot of fun. So anyway, are you a good candidate for liposuction? So for liposuction of the abdomen, I tend to do that more often than other plastic surgeons may. Like a lot of times when other surgeons will tell you need a tummy tuck, I will do liposuction and get wonderful results and really happy clients who don't have the incisions that go along with the tummy tuck or the downtime that goes along with the tummy tuck. I definitely think tummy tucks are overdone, are done too often. There's definitely before and after pictures that I see of people on other pages or in groups where I'm like, that lady totally did not need a tummy tuck. So I think I'm a lot more, I utilize my liposuction a lot more than most surgeons. And I think, I tend to think I want to do the least amount of surgery possible to get you happy. So, that's kind of like my philosophy around things. Who do I think is a good candidate for liposuction? The first thing that I pay attention to is your skin quality. So there are some people that they have, and also I pay attention to two things. One, your ultimate goal, and two, the quality of your skin. Three, another thing, whether or not you have erectus diastasis, and then how severe it is. So first of all, from a goal standpoint, there's some women that come in here like, I just want to look better in my clothes. I just don't want to have all this sticking out. I don't care if I have a little bit of loose skin. I don't, want a tummy tuck. I just want to be, like debulked, basically. And that person, as long as there's like, sometimes even when women say that, I'm still like, no, I think you need a tummy tuck. But a lot of times, if that's the case and they just want to be deflated and their skin is maybe not perfect, but not horrible, and stuff's not hanging all the way down already, then that's a person that I may do liposuction on and not do a tummy tuck. Some people are like, I'm never getting a tummy tuck, and I really would like it if I didn't have to be smashing things down with compression garments and Spanx and girdles and all of that other stuff. So, I don't care if I have skin hanging. I don't care. Okay, that person is a good candidate for liposuction. Then, if a person has just a little bit of hanging, like they had a C-section and they got that little lip at the bottom, like of their belly, that little flap at the bottom, right above their incision, and a little bit of fat in it, and the rest of their belly's pretty okay, that's a person that I would do liposuction on also. I've made a lot of people that little lip go away after the liposuction, because your body's going to naturally have some contraction. Your skin, is going to have some contraction, after the liposuction. The inflammation and everything that goes along with the healing, putting on the compression garment, all that stuff, causes your skin to shrink more than it would if you just lost weight alone. And so if it's just a little bit of lip of skin and the person's skin is overall in good shape, I will go ahead and do liposuction on that person and not do a tummy tuck. Then there's some women who have a small diastasis. Their skin is in good shape. They do have a pretty decent amount of pinch, meaning I can pinch their fat between my hands and get, they have a good amount of fat on top of the muscle. That person, I will have a discussion with them. Okay, listen, you need liposuction and you may need a tummy tuck. I personally don't do liposuction of the central abdomen and a tummy tuck at the same time. And so for those women, when I'm like, if there's a chance that when the small diastasis you have, when we do the liposuction, we put you in the compression garment pushes your muscles back together. The scar that's formed from healing the liposuction can act like paste sometimes when a person's diastasis isn't huge. When those muscles are pushed together by the compression garment and then you go through the healing scarring process that goes with liposuction, it'll push those muscles back together and they'll stay together and the person's belly will go flat. I have a few pictures of people like that on my social media showing and people are like, they didn't get a tummy tuck, and I'm like, no, they just got lipo. Depending on what type of tissues you have, because some people just have loose tissue, like their skin just doesn't, their tissues and skin just doesn't want to bounce back. If you have like that kind of loose just tissues overall, that may not work. But if you have pretty normal average tissues, then you have a good chance, if your diastasis is not large, of that basically almost like the scar from the liposuction gluing the muscles back together. So for those women, I'm like, listen, you need both. Let's do the liposuction first. You got a chance that you won't want the tummy tuck afterwards because this might make your stomach flat. And so when I do people like that, I would say it's like at least a 50-50 chance, if not more. And what I tell them is you're not losing any ground anyway, because if you want me to be the surgeon, I'm not doing both of those things at the same time, because I don't like necrosis and I don't like wounds opening up and I don't like wound vacs and all of that kind of stuff. So since it increases your risk for those complications, I don't do it together. So let's do this lipo first. If it's not enough, we'll come back and do your tummy tuck in 3 months. Some of the women come back for a tummy tuck in 3 months. Some of the women don't need to because their belly's flat and now they don't have a tummy tuck incision. So that's another group of people that I think are good candidates for liposuction first. And I just make sure they have the understanding that, listen, you may need a tummy tuck still. Like, I, give them a shot. And then there's people who I know for sure are going to need a tummy tuck. Like, for sure. But they also for sure need lipo. I will do the liposuction first, and those people too. We will plan the tummy tuck for 3 months later. I will get all the fat out that I can, and then we'll come back and pull the skin later. Because if we do it in reverse, if we do the tummy tuck first and come back and do the lipo, there's a small chance that the skin that won't want to retract all the way back, and we kind of lose ground from the tummy tuck. So it's better to do the tucking second in people who clearly need both things. So, and then sometimes people are like, okay, let's get this lipo done out the way, and then over Christmas break, I'll do the tummy tuck when I have more time off. Because the recovery for liposuction is so much easier than a tummy tuck, like way easier. Especially if I do the liposuction on the person awake, which I am very good at offering awake liposuction in a setting that's very comfortable for the person. Like, people tolerate it really well. When people get awake liposuction, the recovery is like 48 hours. You have to wear the compression garment longer than that, but people are back to work and doing their thing and going about their normal life in 2 days. Whereas a tummy tuck, you're out for 2 weeks. So, it's so much easier. Okay, that's pretty much all I had to say about that. So let me see these questions. Thank you, Tiana. She said she likes the curly hair on me. Hey, Tanya Senses from Chicago. Thank you, Victoria. I live 3.5 hours away. How long would I have to stay in ATO with lipo? If you're driving, I would, after you get I would say about 3 days. So, like, if you say you got it on a Friday, you would come into my office on Monday for a lymphatic massage, and make sure your garments are hitting you in the right places, and make sure you don't need other stuff like foam and board. And then you can drive back home if it's just 3.5 hours away. If it's a flight, then if it's a short flight, like 5 days or so. If you're flying across the country, then I would say a week. I do have those that happen sometimes. Or if you're flying internationally. I want to get my arms done, but I'm going to start a challenge 30 pounds by my 30th birthday, which is October. Okay. Hey, Letitia. How long is recovery for stomach area liposuction? Yeah. So you need about a couple of days, and you can be back to work. You'll be sore and you'll be in your garment, but people are about their business after 2 days. Dr. Myla, are you able to be an added mentor to my research study? I'm not sure. You have to reach out to my office because I don't even know what that entails, and yeah, I can't answer questions like that on this platform. I had a liver transplant. I am stable and followed by a post-transplant clinic. I asked if I could get elective surgery. I'm interested in lipo, and they said I'm in good condition for it and can give clearance only to a board-certified surgeon. Can you give me your opinion on me and my post-op care or the other complications? I'm on program. Please explain. Okay, love, that is a very, I can't say if I think that's a good idea or not without, like, you have a complicated medical history, so I'm not saying it's a deal breaker, but that's not something that I can go into or I'm willing to go into on live stream. And if you want to set up a consultation, I would love to dig deeper into your medical history and see if I think it's appropriate for you and safe for you. Only dermatologists do surgery awake. That's not true. I do. I'm a plastic surgeon, a board certified plastic surgeon, and I do awake liposuction. I'll do awake upper lid lifts, the blepharoplasty. I may do a mini face or neck lift awake. I do labiaplasties awake. So I definitely do awake surgeries. Oh, Crystal. J Plasma, I tried it out and it worked some, but not enough for me to make the investment in the machine or try to charge people extra for it. How about diastasis? How do you know are you trying to ask, how do you know if you have a diastasis? Your surgeon will help you figure that out. How painful is Lipo 360? Okay, so I've had liposuction before on my belly, and I was sore as heck. But I got lipo on Friday, and I was doing surgery on Monday. So it's like sore like a workout. It was hard for me to like do core stuff. Like my bed is really high. See, I got a high bed, and I had a hard time getting in and out of the bed by myself, like for a couple weeks. So my husband would have to help me up and out of the bed. But once I was up and moving, I was fine. Some people aren't even like that. Some people are like, they don't even think they're even that sore. You're sore like a really tough workout for a couple of weeks. But the more you move, the less sore you are. And so that's why once I would get out of the bed, I would be good and I would go on about my day. And since my bed is really high, sometimes I'll have to get help in it because I had to use my core to get in it. So, I mean, it's not bad. It's totally doable. I've had way worse. Hey, Jessica. Yes, my price for liposuction is per area and by size. Like, so basically how long it'll take me to do it. So someone really, really little, their price might be lower than someone, like somebody with a BMI of 28, their price might be lower than a person with a BMI of 33 because it's way more work. Hi, what would you do if I had work done before and was asymmetrical after effects? Would it be both still or just a tummy tuck? I can't answer that without seeing what the person looks like and what I'm dealing with. Can you do a tummy tuck and boob lift at the same time? Yes. Do you do lipo on someone that weighs 280? No. Unless you're like 7 feet tall, your BMI has to be 33 or less. So that's about the only way 280 would be okay. You got to get down to a BMI of 33 or less for me to be willing to do liposuction on you. Okay, so here's the special. Well, I'm not telling you special. If you want the special, email my website, or hit up my website. The website is www.adarabella. Let me type it in. www.adarabella.com. And that'll go to my website and join my email list, and then let us know you want the want to know about the liposuction special, and we'll let you know. What I can tell you though is that it expires on Friday. So if you miss it, then that's it till next summer. What about lipo with type 2 diabetes control? I've done liposuction in a few diabetics and it was controlled. That is a prerequisite for me to do it. And I'm serious about making sure the person's controlled. Your hemoglobin A1C has to be in a good place. You've got to be, I need clearance from your primary care physician. I want to know that you're responsible with your diabetes, because when your diabetes is in poor control, that makes us have lots of complications. And I don't like complications. Your fibroids, Meme Clark, your fibroids are most likely not going to affect whether or not you can get liposuction, unless they are super, super huge and really making your belly stick out. I had one lady that came into me in the last 4 years. I've had one person that came into me whose fibroids were so impressive that I, sent her to an OBGYN when she came in for a lipo consult. And I'm like, yeah, that's not the answer right now. And she never ended up getting the lipo. She actually ended up getting a hysterectomy, and her belly went all the way down. But normally, fibroids are not an issue. Kimberly J asked a really good question. At what point is there a risk of hitting veins and major arteries while doing these procedures? It's a really, really excellent question. So, veins and major arteries in a normal sized person, in the hands of a person who understands the anatomy, being hit is rare. When veins and major arteries get hit, there's been like some extreme cases, and in these situations, the people like lost their lives. It's been in extreme situations where people did not understand what they were doing, and they were literally jabbing the liposuction cannula in the intra-abdominal cavity and hit stuff like organs and stuff. That does not happen in the hands of a person who knows about the anatomy, which plastic surgeons tend to not have that be a complication. I've never had that happen. The other setting where a person could hit some big veins, not necessarily won't hit arteries, but veins, is in a person who has a really high BMI getting liposuction, because the bigger you are, the thicker your fat layer, the fatter the veins that run through it. So literally when people are really, really large, like say this person's 300 pounds, they may have veins running through their fat that are this big. And veins, the walls of veins is really thin and easy to break, where arteries is not so easy to tear an artery with a liposuction cannula, because arteries are muscular. There's a muscle layer around arteries and they're like thick. And so just a cannula going up against an artery will probably just bounce off of it. But when you push a lipo cannula against a big vein, it can tear it and enter it. Okay, so if a big vein gets torn, something this big gets torn by a lipo cannula, you will bleed like crazy. And that bleeding is not gonna just stop with compression most likely, because it'll probably be a tear that's too big. And so this is a reason why there's a BMI requirement. No one's gonna go and do liposuction on a belly of a person, or they shouldn't. A real plastic surgeon wouldn't. If their BMI is 45 or 50, which people like that call and like, I want whole body lipo and stuff like that, trying to get themselves smaller without, losing weight and stuff. And those people are at higher risk for bleeding complications and stuff like that, because they have bigger vessels running through their fat. So that is a really, really great question. So the answer is, go to a real surgeon, a real plastic surgeon who understands that stuff, and also someone who is not likely to pierce through your entire abdominal wall and go down into your organs. Literally, the times I've seen that happen heard of that happening, has always been people who aren't plastic surgeons. A labiaplasty, somebody said explain labiaplasty. A labiaplasty is when the labia, the lips of the vagina, on the outside of the vagina, are like stretched out or like hanging or like loose, and excisional surgery is done to make them back small again. And that can happen. Some people are just like that. It happens with age. It happens after children. Sometimes they'll be like hanging so long that it'll catch on things, or people can't ride a bike and all that kind of stuff. So they'll want those corrected. Lipoing around the band is kind of tricky. It depends on how the band is, where the valve that you inject the fluid into is placed. And so if it's placed, some people place it subfascial, like in the investing tissues around the muscle, but deep to the sub-Q, or deep to the fat. And if it's placed in the fat, like, you have to avoid it. So it just depends on where it is. Yes, I do BBLs. I don't do them often, and I don't inject in the muscle, and I don't make them real big, and I don't make people's shapes exaggerated. So if you want that kind of BBL, I'm not the person for you. I do natural appearing work. If someone needs revision after incisional necrosis due to scarring, need a revision due to the scarring? It depends on How likely is that revision going to have necrosis again? It depends on how long it's been since the initial surgery. It depends on the cause of the necrosis. It depends on how much tissue has to be removed and how much tension is put on it. It's a few variables that it'll probably heal okay, but it totally depends. Shan Archie, send a message through my website to find out the special. BMI for liposuction is 33 or less. BMI for tummy tuck is 35. A person with a history of heart attack and medically cleared which lipo would recommend awake or being put under. Which one I recommend is unrelated to your heart attack, but I definitely would need medical clearance. I live in LA or ILA. I'm not sure if that was a typo. How long can your patients stay in your facilities? So I do not have a recovery house. If a person needs to stay overnight for surgery, after surgery, they stay at the hospital that I operate in. If someone's getting liposuction awake, then they don't have the option to stay. I have a nurse that does recovery services for me for patients who want it, but usually liposuction patients, my liposuction patients don't need that. I don't liposuction people within an inch of their life. They're usually okay. Lisa Ayala Morris, I have a whole video about that topic. If you gain weight after a liposuction, does fat redistribute in another area of your body? I have an entire video about that. That's literally almost the topic, the title of it. I would look through my videos. I think it's called like if I have liposuction, will the fat come back somewhere else or something like that is the name of the video. My liposuction starts at 4,000 and goes up from there depending on size and number of areas. 6 weeks, you need to stop smoking before any surgery with me, and I check your urine to see if you really stopped. You have to wear the compression garment for at least 3 months. My consultations are $150. 5'4", 177. You're probably in the BMI range, but Google BMI calculator and type your height and weight in and see what you come out to. But I think you're probably in the range. You're probably okay at that. Hi, Carla. I don't do Vaser lipo. I wouldn't say it's safer than traditional lipo. Both of them can be dangerous. And Vaser probably has a higher risk of complications like burns and stuff like that. But in the hands of somebody that is experienced and knowledgeable, it's a good modality. I just don't have it, but I don't have anything against it. Marie Rucker, yes, most times I can tell from pictures. Every once in a while, somebody's pictures, I'm like, I can't really tell which thing I think they need the most. But usually in those people in the setting of like a virtual video consult, I can figure it out then. All right, I guess I'm going to go ahead and sign off, y'all. I have a liposuction case in the morning, so I need to get some sleep. So if you are interested in my liposuction special, you can call my office in the morning, 678-325-0006. Or you can reach out to my website at www.ederabella.com. And that's pretty much it. Stay safe, ladies. All right, bye. Hey, Melissa. Okay, bye.